Hi, this is Jaisa Olasky. First of all, thank you to the chairs for inviting me to participate in this session. My talk is entitled Flame Retardant Tools, Change Your Mindset. I have nothing to disclose. First, I want to cover some tools to combat burnout. Generally speaking, these tools are divided into two different types of interventions: individual interventions, which can include things such as mindfulness techniques, as well as personal coping strategies. And I'll go into more detail about those in a few slides. And the second category is usually organization and workplace interventions. These can include things such as changes to the operation of a practice or changes to the whole healthcare organization. And these interventions are designed to improve teamwork, reduce workload, and increase the level of participation in decision making. There have been some studies that have looked at which one of these types of interventions is more effective. And they found that individual interventions are associated with a small significant reduction in burnout. However, organizational or workplace interventions are typically associated with a larger or mediumly significant reduction in burnout. However, as we go through these different options, I think you'll see that they actually work together, and that generally speaking, any kind of organization intervention also affects the individual and vice versa. So to get a little more specific, what is an organization or workplace intervention? So this will vary widely depending on what type of practice environment you're in. It's actually really hard to go through that in a short talk. But generally speaking, you can look at the areas of work-life model. I'm referencing a paper that's the reference is up on your screen. And there's 6 areas in which the job and person match is critical. These areas are considered to be the workload, control, reward, community, fairness, and values. So these are things that the individual can look at either before they accept a new job or while they're considering changing jobs. They can ask other providers when they're at that job interview how they feel about these topics. They can try to gauge it from reviews that they see of the workplace. But essentially, the higher the match between the individual and the workplace, the overall lower risk of burnout. So these are things that an individual can look at and try to determine how they feel about reward or community culture, atmosphere. And they can start to decide whether the issue is something that can be changed at their workplace, or is it something where they actually need to look for a new job. It's a lot easier to go through individual strategies because, again, the organizational ones will vary so much depending on your practice environment. So we'll go into more detail on the individual strategies. One tip is to have strategy sessions. Some of these tips are from the Stop Physician Burnout book. And essentially what it involves is every week or every other week setting aside just a very small amount of time so that you don't contribute to your own burnout with that time. And this is supposed to be a regular activity to assess how things are going versus how you would like them to be going. So this is just time to reflect. You could either journal or open up a Word document and think about, what is it I want? How are things going? What is working? What is not working? What do I want to change? And when will I start this change? And these don't need to be large concepts. These can be very specific, small things. And the idea is that if you get in the habit of doing these sessions every other week, that over time you'll start to have more satisfaction and start to be able to make change in small ways that over time becomes large change for yourself. Another way that the individual, another tool you can use to fight burnout has to do with the electronic health record. This has been shown as being a large source of stress for a lot of physicians across fields. The number one tip here is to change your attitude. I know that sounds a little bit like easier said than done, or maybe a frustrating comment to make, but really these electronic health record is, depending on which system you're on, these often are actually great systems that are underutilized by a lot of physicians across fields. So you can commit to being a super user and put in some time ahead of time, which will save you later. You can borrow templates from others. You can work on things like batch process requests. And so this is a good example of where an individual intervention is also a organizational or workplace strategy. So you wouldn't necessarily want to make this change without running it by your, if you're employed, your whole office, or if you're a solo practitioner, then your admin. And essentially you could make the decision that you will only check your electronic health record messages twice a day. Anything that's more urgent, they'll need to page or call you directly. But instead of being distracted throughout the day and trying to respond to a variety of different requests from either other providers or patients, you can still have excellent patient care by batch processing electronic health work. Another area that for individual change, another tool to combat burnout is mindfulness. There are many breathing and exercise techniques described thoroughly, and a lot of that just depends what works for you and what you're able to incorporate in as a habit. But one thing that would help most of us is to try to work harder on noticing when we're not present. So right now, as you're listening to this, I want you to stop. And for a minute right now, just think about, what are you thinking about right now? You're listening to this, but you're probably not just listening to this. All of us, surgeons, we're all perfectionists, we're overachievers, we like to multitask. So probably none of us are just listening to this PowerPoint. So what else are you thinking about right now? And are those things you actually need to be thinking about right now? Can you release those thoughts and return to the task at hand, which is just listening to this talk? And you should try to do that on a more regular basis when you're at work as well, as it has been shown to increase mindfulness and increase overall satisfaction and reduce stress. Scheduling is another large issue. Now, a lot of what you'll find out there in the literature about burnout does not apply very well to surgeons. A lot of it has to do with making a life calendar, like I've listed here, where you include all of these different non-work activities on your calendar, and you really don't give in. You defend it like it's your work time. Now, of course, surgeons especially, we take lots of call. There's very few surgeons out there that don't have some sort of call schedule that could interfere with any ability to make a life calendar. So I'm not suggesting that this is a perfect solution, but sitting down once a week to at least plot out these times, and within the constraints of your call schedule and your OR schedule, try to have some time that's dedicated and literally scheduled. Well, on one hand, that might seem like, oh, that's really not going to be good stress release because you're scheduling it. In the end, you'll be more likely to follow through and actually spend that time in a non-work activity, which will overall decrease your stress and decrease your risk for burnout. I would also recommend using technology to help manage your schedule. So I try to regularly push my teams, whether it's work, friends, or family, to use electronic schedule invites, even for in-person meetings. Of course, in the current climate with COVID-19, most of our meetings are scheduled electronically anyway. But even before this, I was really trying to push that through as much as possible. The reason why is because this is a good example. So this is a current email that I get once or twice a week from a wonderful individual who I know from my yoga studio. And she has been amazing since the studio has been closed about having either Zoom sessions or in-person outdoor sessions. But what happens is I get this email and it comes through, as you can see here, where there's all these different days and times. So in order for me to know whether I can engage in this wonderful activity that's designed to decrease my stress and be a fun leisure activity, I have to check my Epic schedule, my Outlook schedule, and my Google schedule, all while trying to look at this email at the same time. So it's a lot easier for me if any kind of invitation comes in the form of either an Outlook or Google invite, because then I will know right away whether it conflicts with something else that I already have scheduled. And I realize that's asking a lot more of the person who's trying to organize the event, but I really do think it helps to use technology, because then you're not constantly worried that you're missing something. If you prefer to do your schedule on paper, it's really the same concept. It's really the idea that as soon as you're looking at even leisure activities, trying to put them on the actual schedule will really help you follow through and be able to do those activities. So in conclusion, while working toward avoiding or stopping burnout does take individual work, You will be much more successful if you're able to change the work environment and culture to support your goals. Thank you.